If you're ever in Bangkok in Thailand, go to this place called Happy Birthday Cafe.
But maybe don't do that right after your hair transplant. They're gonna eat those little grafts. Let's react to this hair transplant recovery video by Mo Samuels.
6 months ago, I got a hair transplant in Istanbul in Turkey, and this is how we're looking right now. In this video, I'm going to take you through the full process from getting it done all the way up to 6 months. We're about halfway through the full results, right? So they say after 6 months, you get 50% of the results coming through. If this is 50%, like I'm going to look like the Wolfman by the end of it. 1 year, you get 95%, and a year and a half, you get 100% of the results.
Yeah, I agree with that general timeline. So usually, like he said, at about 6 months, you're looking at about 50 to 60% of the outcome, 95% at a year, and full result can take up to a year and a half. So I do agree with that. I do think he's going for that really kind of shorter forehead look. When I look at the image of the markings, it looks to me like he already has some hair there centrally where they started the hairline in terms of the height, but it looks like his hairline was already at a fairly low position. But let's keep watching.
Mo, why did you get a hair transplant? This is ultimately the reason why.
And I have a long form video where I discuss exactly why people actually go ahead and get hair transplants. And the most common reason, in my practice anyway, is because people actually want to think about their hair less. And that's generally the most common reason. But of course, there are always going to be a multitude of reasons why people consider cosmetic plastic surgery, including hair transplants.
My hairline is absolutely clapped. I was going to wait till I was a bit older to get it done because it's better to get done later.
It's interesting. Now that I look at that image of him compared to that initial image that I saw where they did the markings, it is looking like they went lower on the central hairline than where his hair was. It's also possible that other areas on the scalp might open up and then he might need additional grafting there. So hopefully they've left them enough in the reserve to be able to transplant other regions should that be necessary later on. And I also hope that he's on medical therapy like finasteride in order to prevent further loss of hair.
So the next day, I just jumped on a plane, went to the first clinic. That's not actually how it happened.
As I often emphasize in my videos, it's really important to do your research, to not just go to the first place that you see on the internet or just the local place, that's in your town. Do your research, check out reviews, check out general reputation of the doctor, check out the gallery, make sure you see the work that they've done in the past, and make sure that you actually get to talk to the doctor before you sign up for surgery. I know that seems maybe obvious to some, but in many clinics, you never actually get to see the doctor, talk to the doctor. You just come in, a consultant books your surgery, you come in for surgery. It's a team of technicians with no doctor around. That's a problem. So make sure that you're doing the right homework so you can keep yourself safe and optimize your chance of success with the surgery.
You don't actually have to shave your hair, but they said the results are slightly better. It's a little bit quicker to do as well if you do get your head shaved.
Yeah, I generally now have been pushing more and more patients to shaving their head. But of course, I have patients who prefer a no-shave approach for the donor area and the recipient area. And sometimes we can offer them a fully no-shave procedure if the overall procedure size is smaller, like up to 1,500-1,600 grafts. If it's a larger procedure, we usually have to at a minimum shave the donor area, but sometimes we can offer them a procedure where we don't shave the recipient area. It's a case-by-case type of situation.
Although it's kind of ironic me saying this because I've had a hair transplant, I wanted to be bold for a few months, like a baptism of fire, to experience it, realize it really isn't actually that bad and get over that insecurity. And bro, shave it. Like even if you're gonna get one, shave it, don't keep it, because it was so good for me mentally. It made me realize like it's not actually that bad at all to go bald.
Now I can see the markings better. Centrally, they've dropped the central hairline by about 1 centimeter, and they're doing quite a bit of work in the frontotemporal areas. The hairline overall is fairly straight across, and that is their overall design plan. They're not really doing too much at the temples. It looks like his temples are already fairly strong, and you can see the donor area marked out here in blue as well.
So as you can see, this is immediately after getting it done. I'm pretty smiley.
And now we're seeing the area transplanted. You can see the grafts in place. Usually for an area of this size, you can typically, with high density packing, fit anywhere from about 1,400 grafts up to sometimes about 2,400 to 2,600 grafts. It depends on the caliber of the hair for how many sites you can create into that space. And of course, you have to make sure you have the donor area for it. And you have to make sure that it aligns with the density that's in the vicinity. And what I always tell patients is that when we start with a very bare area, it's nearly impossible to bring it up to the original density in a single procedure. So some patients end up coming back to increase the density closer to their original. And that's especially important when the area nearby, like his forelock, for example, is quite strong. When patients already have some general thinning in that vicinity, it's usually easier to create a good match with a single procedure to that hairline area. But when you're trying to create a very, very dense appearance, that usually requires a smaller second procedure to bring that density up. And the reason for that is not because anyone's being lazy, because there's a physical limit to how many grafts you can pack into any small area, right? So you need to leave some healthy skin around each of the recipient sites that you make. Now, that healthy skin that you're leaving for proper blood flow and survival of grafts, and that skin normally has a hair sticking out of it, right? If it's in a super, super dense area. So if you want it to look as dense as your densest parts of the scalp, that will require that smaller touch-up procedure.
It wasn't really painful. They numbed all my head and stuff. And it was just like a prolonged, uncomfortable haircut, really. Day one, and you have to be super, super careful about not knocking any of the grafts, not touching it. I actually got into the car and hit my head on the roof of the car and was like, I've just ruined everything.
Oh man, yeah, I've seen that happen before. Yeah, we try to get people quite paranoid about any trauma to their scalp. So my patients tend to be very, very careful, but anything's possible. I think the neck pillow is a good idea. Sleeping with the head of bed elevated, as you can see him doing here, is a good idea. I don't find the headband to be necessary, and I find it to be potentially a little risky because if that headband shifts when you're sleeping, for example, your grafts are really close. So some people place that headband because they feel like it's reducing the swelling or keeping the swelling from coming down. But in reality, it's better to let that swelling dissipate over the course of the first week. And in my opinion, go headband free.
Went home, chilled out, didn't really do much. And then day two, they tell you to like hide yourself away for a week.
We also don't do this type of wrapping and gauze bandaging of the back as long as the work is done safely and with minimal trauma. When people leave the office, they're not having any active bleeding. So putting this type of pressure dressing, I don't find to be necessary. The issue with this type of dressing is that when you go to remove it, you could be removing a scab that then causes bleeding. So then you're having bleeding from the back of your head, and people can get nervous about that. So again, my patients leave the office with sometimes a surgical cap on, something like what I'm wearing now, over the grafted area if they're looking to cover it, or just open to air with no bandages and no headbands.
But day two, I wanted to go out in the world and show everyone my bald head and like not hide away and like actually go out and rock the bald look. So went around some markets. Everyone was staring at me 2 days after the hair transplant.
But I think they're pretty used to it in Turkey.
This woman came up to me and she was like, fam, your hairline is looking absolutely sick. Can I touch it? I was like, nah, you can't. First couple of weeks are super annoying. You just got to be super careful. But in terms of actually being bold, like I didn't want to wear hats and hide away. So I just kind of rocked the Andrew Tate techno raver matrix look.
It looks like he's going back to the clinic or to some other clinic for some red light therapy. While this might help, in reality, as long as the grafts are taken care of properly and your surgery is done well, the survival rate is extremely high in a good clinic. So you shouldn't need this red light therapy for even better survival, because if your survival is already 98, 99%, how much better can you possibly get it with additional treatments like this? But, some places offer it, and I think it's fine. It's unlikely to hurt him as long as he doesn't stand up and knock his head on the actual machine.
Between 3 and 6 days, I started to get this awful swelling. Like despite sleeping upright, taking anti-inflammatories, like doing everything, I think it's kind of hard to avoid. I got this like mega mind level. Like look how big my head looks.
And part of the reason for that extra swelling building up right around the grafts is because of this headband. So if you just went without the headband, that swelling would just gradually dissipate through the face. Instead, he's looking like a mushroom, and all that swelling is gathering around those grafts, which I don't think is ideal. So I think it's best to just go headband free.
And when your head's swollen, it actually stretches the skin. So it makes the hairline look a lot higher than it is. And I was like, oh shit, have I got the hairline in the wrong place? It looks basically the same. But basically there's so much fluid under your head that it actually like moves the hairline up when your hair is swollen. The first 7 days, you can't really do much.
Yeah, you definitely can't tell what's going on with your hairline in that first week because of the swelling that's there. So I do get that type of frantic call or text from patients sometimes a few days later. And they're like, oh, did we put it in the right place? And it's like, yes. We followed the markings, everything was done properly, and then as the swelling settles, they start to see that, hey, it actually looks pretty good.
You can't smoke, you can't have sex. They say you can't have sex, but how much of a difference? They told me not to have sex a week before getting the hair transplant. I was like, bro, what is that going to do? So immediately afterwards, it's no sun, no smoking, no nicotine, no alcohol, basically nothing fun, no sex, nothing that might knock out your hair. You can't bang it. You got to be really careful because you can actually like dislodge the grafts. It actually cracks me up to see the amount of people like looking at me and trying not to look.
He's not alone. Turkish hairlines.
To be fair, I think it's barely noticeable, to be honest. One thing I didn't want to do was just stay inside, hide my bald head under a hat, and kind of like live in this insecurity of being bald. So I made sure to go out, rock the bald look. I probably went out a little bit too much. Like, you're not meant to get it in the sun.
I have my patients wearing a loose fitting cap after about 3 days. But if they're looking to fly, let's say the day after surgery or 2 days after surgery, then they put on a surgical cap and then they put on the loose fitting cap. And I'll show you what loose fitting cap I'm talking about. You guys have probably already heard about my Feel Confident hair care line here. We also have skincare products, but this is the cap, and you can actually get this on the website as well, feelconfident.com. But yeah, no, this is the loose fitting cap. So it's on a Velcro. It's very convenient. And what's nice about this cap for specifically hair transplants is because this part kind of stands up a little bit here. So this frontal area is more vertical and it's sort of sitting up. So as you use it after a hair transplant, your grafts, especially right at the hairline, are very protected. So it's a nice design to a looser cap. And this is what you want to wear as early as really the day after the procedure, as long as it's protected with a surgical cap first. And after 3 days, you can just use the loose fitting cap. And after 2 weeks, any kind of cap or hat should be fine.
But 6 days after getting it, I actually moved to Thailand. So I flew straight from Turkey to Thailand. If you're ever in Bangkok in Thailand, go to this place called Happy Birthday Cafe.
But maybe don't do that right after your hair transplant. They're going to eat those little grafts.
Cool, but it's like they had a sense that I just had a hair transplant and they're all like trying to rip my hat and like tug on it. So I was like, yeah, it's probably not a good idea to be here. In the first 10 days, you cannot sweat. Like, it's really important not to sweat. I was actually really worried about traveling to Thailand because it's going to be so hot and I was going to sweat and then all the grafts are going to get infected or dislodged, and I was really concerned about this. But after about the 10-day mark, I started to go back to the gym. You can actually start sweating again. I started to train.
Yeah, we usually recommend light activities after a week, and then after 2 weeks, resuming most activities, including the gym, and 3 weeks for swimming and sauna and skiing. That's one that sometimes comes up.
The clinic said to me, like, different clinics will say different things, but the clinic said to me, I can't train for a month. Obviously, going to the gym is my job. I can't do that. I can't not train for a month.
We find 2 weeks to be just fine for most types of activities, including training in the gym. Because yeah, I know some places will tell you for 3 months you can't work out, but that's pretty extreme.
There was a paper as well that I read that showed that grafts are fully set after about 9 days. There wasn't any cuts or open scabs or wounds.
Honestly, after about 72 hours, it's pretty difficult to disrupt the grafts.
After that point as well, so it's like, okay, I'm probably not going to get infected. 2 weeks in, we're living in Bangkok. As you can see, you can obviously tell I've had a hair transplant, but it isn't looking awful. Like, if you glanced at me, you probably wouldn't notice it. It's only if you actually like looked at me and made eye contact would you see it. So I was pretty damn happy with the results up to this point and how I was looking. I actually started picking the scabs after about 2 weeks as well in the shower, which is really, really bad.
Yeah, there's no reason to pick at them if you're just lathering over the area with your showers. After 6-7 days when you start to shower, you're going to work out those crusts day by day. And usually by day 10, 11, most of those crusts are gone.
You're meant to get the scabs off, but equally, like, I was so worried about pulling out the grafts. I got to a point where I was just like picking them all off. I couldn't stop picking it. But I don't think I actually pulled any grafts out. I was very careful about it in the shower.
Yeah, after about 3 days, it's pretty difficult to pull out any actual grafts. What you're seeing coming off after that are the actual shafts, right? As those shafts are shed by the follicle. And you're also seeing some dead dead skin come off, and that can sometimes worry people, these little white flakes. But that with the crust is what you're normally noticing around that time frame.
And you are meant to scrub them off. I think I say after about 2 weeks.
By 2 weeks, most of the crust should ideally be already scrubbed off. And again, not so much like a firm scrub, but just a gentle lather in the shower should do.
But then at 14 days, I started to lose some hair. It gets a lot worse before it gets better. So you go through this thing called the ugly duckling phase, which is basically where all the transplanted hair falls out. And I was like, I've avoided it.
Yeah, people think they're going to avoid it, and they never really do. And not only that, but you can get some shock loss to the neighboring hair, right? So the rest of his hairline there is potentially, susceptible to some shock loss. And usually about maybe 10-15% of that area could thin out a bit. And that will typically come back with the regrowth of the transplanted hair around that time. That shocked hair in the vicinity also starts to regrow. And that's when things start to look better and better.
I also got my first haircut, and I cannot tell you how much better it looked and felt getting some shape.
And notice how his recipient area still looks pink. And that's normal. And that's what we see usually for at least 3 to 4 months. Sometimes it can linger around even longer. I've seen areas be pink for 10 plus months sometimes. It depends on the person's skin, and it depends on whether they're truly avoiding the sun, or if they get sun exposure, that area will be the first to turn more red and potentially even get a sunburn.
Even though it's like super short, I started to get weekly haircuts in Bangkok just because it made it look like a million times better.
Yeah, we'll recommend starting haircuts as early as 3 weeks post-op. So it seems like he waited about that long as well.
Made me feel more confident and like happy with the way that it looked. So you can get a haircut after 2 weeks, but you have to be super careful.
To my eye, personally, from that view, the hairline looks fairly straight. I usually like to leave a little bit of a recessed look. But again, everyone has their preference. I definitely have some patients who request a much kind of straighter type of hairline. And it's always this balance between, what I think is aesthetically optimal and what the patient thinks is best, and trying to negotiate as much as possible. There are surely scenarios where what I think is best, the patient doesn't agree with, and vice versa. So that's all about, finding the right fit for you when it comes to, doing your homework for the right doctor, right? So that's some of what you're looking for, is an aesthetic fit as well. Remember, it's always easier to drop the hairline a little bit more in the future than it is to try to reverse a hairline that's been dropped too low in the first place, right? Because then you're looking at either using like laser to remove those hairs that are in a, potentially too low of a configuration or incorrectly placed sometimes, or you're using FUE technique to actually extract those grafts, but then you're left with little tiny scars, right? So both methods are possible, FUE extraction versus laser hair removal, but neither one is optimal. So it's usually best to just avoid placing the hairline too low in the first place. And remember, those hairs are going to be with you for most likely your whole life, right? So you have to envision how, you'll look in another, 10 years, 20 years, 50 years, right? And think like, will I be happy with my hairline in that position, especially as my hair overall thins a bit, even on medical therapy? And maybe if a crown area opens up, you don't want to have a crown that's wide open and have your hairline be down here, because that does not exist in nature, right? So people who lose significant crown hair will have a higher hairline. I mean, that's just kind of part of natural aging and part of a natural androgenetic pattern. So ideally, you want to create something that is observable in nature, right? For it to look as real as it can. So all those considerations are important when planning out hairline design.
2 weeks to a month, it's not looking great. It's looking pretty bad, but you can kind of resume everything, do everything as normal. You can train, you can swim, you can go in the sea, you can do all that kind of normal stuff. You just got to stay out of the sun. And this is like the worst phase visually in terms of how it looks. After about 1 month, it had all fallen out.
Yeah, remember that sometimes the hair will actually grow. The transplanted hair will grow before it falls out. And that can be confusing for some people because they're like, oh, now it's not going to fall out. It's actually growing. But rest assured, it'll still fall out, but it can take longer for some. So when I do my 3-week follow-ups, there's some patients where it's growing. It hasn't even started to fall out. And they're like, oh, maybe it won't fall out. And I tell them it still will. Then, of course, between 3 to 6 weeks for those patients, the hair still falls.
Man, you can see the regions where my hairline would be if I didn't have the hair transplant, kind of like how far back it goes at the top on those regions. And I was like, what? There's like 3 hairs left there. What if it doesn't grow?
Yeah, they really didn't do a whole lot of central lowering, which I think is a good thing. I think they just went maybe about 1 centimeter of reinforcement, a little bit lower. I think that was a good idea. I think out laterally, again, I probably wouldn't have dropped it quite as low. I would have left them with a little bit more of a recessed shape. But again, everyone has their preferences, from the doctor's preferences to the patient's preferences, and all of that needs to be considered.
Week 5, looking pretty bad.
But I knew this was a thing. It's basically shock loss, the shock of actually the hair being moved. The follicle ejects the hair, and then you have to wait for it to grow through the skin and grow again.
Yeah, what we're looking at here is some mild folliculitis. It's really fairly mild in his case. Some of my patients get, worse folliculitis. Some don't really get any folliculitis at all. It's very variable. The first step with folliculitis is always going to be some warm compresses. That typically just resolves them on its own. If that's not helping, then we sometimes will prescribe a topical steroid like a clobetasol cream, and that seems to help most of those areas. And if that's still not enough, occasionally we'll go with an oral doxycycline for its antibiotic properties, but also for its anti-inflammatory properties. So that's sort of the regimen that we follow, and that, in my experience, has controlled everyone's folliculitis. And remember, this can happen in the recipient area, but it can also happen in the donor area.
And this process of it growing through the skin over the next maybe 2 up to month 3, it was so itchy, man.
For the itchiness, we usually will recommend a topical Benadryl cream. You have to make sure you don't start that too early, so at least a few weeks after the surgery. If people have a lot of itchiness at night in the first few weeks, you can do something like an oral Benadryl, but during the day, Benadryl will make you drowsy. So topical Benadryl is my go-to for an itchy scalp, whether donor or recipient, after a few weeks, post-op.
A massive misconception is that you can get a hair transplant and you don't have to take anything for it. You need to be taking finasteride to stop the root cause of the issue, or something to deal with the DHTs.
I'm so glad he said this, because a lot of people just forget about it, and they think that for some reason they're immune to further hair loss, right? No, chances are you wanted the hair transplant in the first place because you saw signs of androgenetic loss. So there's no reason to think that it won't continue to progress. Just because you had a hair transplant, that's not going to save you from further signs of AGA, right? Or androgenetic alopecia. So finasteride is the #1 thing that we recommend to help prevent further loss. And usually it's a 1 milligram oral tablet. We have so many videos on this topic, so make sure to check out more information about it. It's also available at feelconfident.com if you wanted to obtain it, where they send it directly to your door. This is for US customers only, but finasteride is going to be the #1 choice. Some people will increase to dutasteride if finasteride's not helping, but typically finasteride 1 milligram oral pill is the way to go to start. And then you see some people have side effects and they have to go on a lower dose. Some people end up on a topical administration of finasteride. So there are different options, but thinking that for some reason you won't need it and everyone else needs it is, I don't think, the best approach. I have some patients who just look at their family tree and say, oh, I probably won't need the finasteride. And, that's not a great approach, especially if you're committing to a hair transplant, in my opinion.
After about 2 weeks, I started using topical minoxidil again. Everything was healed up. I didn't see a reason why I shouldn't take it.
Topical minoxidil application is fine after 2 weeks post-transplant, but we do in general prefer oral minoxidil because that's going to be overall more impactful for one's hair in terms of thickening the hair. Now, it looks like his hair overall was quite thick in the areas other than where he had transplants. So perhaps for Mo, he didn't really need minoxidil, especially in a pill form. But for many of our patients with thinner hair diffusely, oral minoxidil does a great job at thickening up their hair. So that, once again, is available at feelconfident.com, and we're big proponents of it in my practice.
And then I kept using finasteride throughout the entire thing just to like offer that protection and keep my remaining hair in check.
But again, the most important medication is still the finasteride. They're doing two different things. The finasteride is preventing further loss, and the minoxidil is just thickening what you have. So if you're going to pick one, generally pick the finasteride. You don't just pick one because you've heard that the side effects are worse with one versus the other, right? It's not just picking based off of side effects, it's picking based off of what the actual function of the medication is.
The 1 to 3 month mark is definitely the worst. And you're like questioning, you're like, is it going to grow? Is it not going to grow? And it wasn't until about 2 months, 2 weeks that I started to see these small little baby hairs coming through around the sides of the hair that I kind of already had in place. Through pure chance, all the barbers in Bangkok I went to, the one guy, Job, had a hair transplant. And he was like, trust the process, Mo. Like, it's coming, it's going to grow, it's going to grow. I know it doesn't feel like it.
2 years ago already.
Also had a hair transplant. So
Yeah.
here's an expert, and he's like, okay, you got to be patient.
Okay, done.
Perfect, thank you, man.
Yeah, it's around like 3 months post-op where some of my patients are texting me and they're worried. Is it gonna come in? Is it gonna come in? And I just tell them, just please be patient. It will. It just takes some time.
And sure enough, around the 3 month mark, like I feel like it just exploded out of nowhere. Like I started to see growth. I started to see the hairs coming through. It started to look good. It was literally like one day I woke up and it like started to look normal again. And this is when I was like, yes, like, it's actually gonna work. I think it still looked a little bit thin, like it didn't look ideal, but I started to regain some kind of normality with my hair. 4 months in, still getting longer, still looking a little bit better. The hairline did look super fake at this point though. Like up closer, if you're near me, if you like knew what to look for, you could tell straight away that I had a hair transplant. It was still quite red, like I had a red line around the front, which has started to finally go now after 6 months. I was a little bit worried that was going to stay, like that was going to scar. 5 months, it's growing, it's getting better, it's getting better. I think the main thing is just like stay on top of the haircuts. If you want it to look good, like keep the sides short, keep them shaven.
And the other thing is post-operative PRP. We found that actually helps the hair come in a bit sooner. So many of our patients will get PRP with us during their transplant, and then they'll return at usually around 3 months post-op, 6 months post-op, and about 9 months post-op to give that additional boost of growth factors. And then we do see, in general, a quicker regrowth of their transplanted hair.
And then 5 months into 6 months, and it's looking pretty damn good.
And at the 6 month mark, in my experience, it always gets better. So some patients are already quite thrilled about their results and they feel like, oh, wow, like it's looking great already. And I tell them it's just going to get better, and it always does. And then I have patients, of course, that, they're just going to wait it out, and that's fine. And then there are patients who are just like very worried, right? Oh, it's still a little thin, like, what's going to happen? And I tell them, like, look, just be patient. Things get better. And we have one of our patients, Max, he documented his entire post-operative journey. So make sure to check out that video if you want to see what it's like through at least 10 months of growth with one of our patients from my clinic.
And this is where we're at now. What have I learned? What do I wish that I knew going into this? So the first thing is manage expectations, boys. There is no cure for baldness. Like, I might be bald one day. I know I like to joke about it being like, oh, there'll be a fat, old, ugly, bald guy. Like, if it came to it, I would just shave a hair off and you can look sick bald. Like I respect bald dudes. When I look at them, like I feel like I've copped out a little bit. I feel like a bit of a traitor because I've done all these things to save my hair. But like when I look at a bald guy that's like in shape, looks good, wearing good clothes, I'm like, man, this guy's a secure, confident man. I respect that. So you got to manage your expectations and realize, okay, there isn't a cure for hair loss. You do have to take medication for the rest of your life.
Alopecia areata, by the way, before you guys start making your little comments, make sure to check out my main video on the channel that will explain everything in case you're like, oh, this guy talks about hair loss and he's a hair transplant surgeon. Maybe he should help himself. Stay informed, fellas.
If you want to maintain your hair, even if you've had a hair transplant, it's even more important to take, or I spoke about in other videos like here.
Oh, they did 3,000 grafts. That's quite a bit for that area, but it seems like he had overall nice results, so who am I to judge?
One thing that I did learn is you've got to accept some compromise with it. So obviously you want this like super low, super sick, like youthful looking, rad, like it's kind of like an Italian, like prime genetic looking hairline. Like,
but you see, like the guy he just showed just now right here, there's some recession here, right? There's a slight slant to the hairline. It's not coming straight across, right? It's slightly pulling back. So that's more of the type of design that I like to create. And I think this is a natural hairline from what I can tell in this image of this gentleman, but it is not a straight across hairline. So that's what I was hinting at earlier. And if you look at my gallery, that's more of the look that I prefer.
Every man wants this guy's. I'm gonna put Andre on screen because Andre is just like the pinnacle of man with like sick hair.
See, that's a straighter hairline, right? So again, everyone's got their preferences, but you have to account for the potential for progressive hair loss over time.
In what he's doing, he's got like sick hair, sick skin. Big up Andre. We're not all that lucky, so you've got to realize you've got to make some compromises in terms of like the way that you would like it to look in your ideal world and what's actually practical and optimal for you. So I could have gone and got the hairline dropped super low, the temples completely filled in.
He's already using the hair that he has there at the hairline now to cover down over the forehead, shrinking the forehead down even more. So I'm glad he didn't go any lower than he did.
But it might have actually only stayed like that for a few years.
And here's the thing, if he did in fact have 3,000 grafts that were transplanted to that small area, can you imagine how many more grafts he would have needed if they were to drop the hairline down even more? For every centimeter at the hairline, you can sometimes fit 800 to 1,000 grafts. And remember, there's a limit to how many grafts you can take from the back and the sides before those areas look too depleted. For most patients with a solid donor supply, you're looking at about 6,000 to 8,000 grafts before you really start to sense that depletion. Again, that's the average, but for some people it's less, for some people it's a bit more. But imagine he's already gotten, maybe 40 to 50% of the supply placed into an area this small, right? So imagine now if a big crown area opens up, what is he going to do? Right? So it's a good thing he didn't go any lower is all I'm saying.
But it might have actually only stayed like that for a few years. And then 10 years time, when the rest of the hairs continue to go back and recede, even if I'm on finasteride and doing microneedling and PRP and other things, like it's not guaranteed to protect your hair. You will still lose hair. They're going to have no more hair left to take because they've done so many grafts on the front of my head to drop the hairline down.
We see more and more people coming in from lots of different clinics, some from Turkey, some from the US, where, they need a repair, sometimes of the donor area because it was over harvested. So it looks overly depleted. So now they have like a different alopecia pattern essentially. And now they want to correct that. So everything has to be measured and done properly. When I see some comments on some of my own work where people say, oh, you should have gone lower the hairline, you got to be so careful with any type of lowering. And just in terms of overall densities created, everything just has to be done in a proper, safe, measured way for optimized safety and optimized long-term efficacy of results.
What's going to happen in 10 years when you start to lose hair on the top, which you inevitably will? What's going to happen then? And something else that I haven't mentioned in the other videos is that my hair on top, I'll try and put a video of it or a picture of it, I don't really want to mess it up now, is pretty thin.
And going back to that, I think Mo would probably benefit from oral minoxidil if, of course, his doctor agrees with that. But that thinner kind of central zone would benefit from oral minoxidil much more from what I've seen in my practice compared to the topical Rogaine.
So like it might be a matter of me needing another one down the line. And if I did drop my hairline, I wouldn't have any more hair that I'm able to move, but I've still got some hair in that donor supply that it could build out this density on top with if I needed to do it.
I'm glad he was thinking ahead. I mean, more power to him. A lot of people don't.
But like on the subject of this, I've been getting PRP, PRF. I've basically been doing every hair loss treatment known to man. I got a bit slack after getting the hair transplant. I got a bit comfortable with like not doing these things, not microneedling.
For my transplant patients who are on primary medical therapy, which I see as oral finasteride, oral minoxidil, we don't recommend that they just continue indefinitely with a whole lot of other treatments, right? So it's not like all of my patients are microneedling and getting PRP endlessly and doing a million, different vitamins. I mean, I think there's a lot, you can do in terms of like healthy diet and just kind of being safe with how, you treat your hair. But if you're on the two medications, Usually that's enough as far as preserving your hair and also thickening it up some without needing a million other medical therapies or different treatments that are just in some ways going to drive you crazy.
So you've got to maintain it and actually look after it going forwards.
But there are some patients who, for example, can't tolerate minoxidil, right? So then we consider PRP treatments more regularly, or sometimes laser caps, right? And for laser caps, we really like the Capillus system, and we have a link to that below. So check them out if you're interested in one of those types of caps.
I think another thing to consider is that when you're picking a place to get it done, look at the work of the surgeon that does it. This is something that I wasn't aware of and didn't do either. Like I kind of lucked out because I was happy with what I got and what I ended up with. But I've learned that you don't want to just go to a clinic because of the name of the clinic. Look at how they build hairlines, how they make hairlines, how the other patients look, because there is going to be a certain aesthetic that each surgeon is going to do, and you might like it and you might not do it. So for example, like you're not going to go to a barbershop just because a barbershop is a certain barbershop. You're going to want a specific barber in that barbershop.
Yeah, you have to first pick your surgeon, and then you trust that your surgeon can pick a great rest of the team that will do their best to give you the best possible outcomes. So definitely check out galleries. And sometimes patients forget that in addition to just Instagram, there's an actual gallery, usually on someone's website, that will give you, many examples of their results. And if you don't see that, then you probably ought to look for a different place, right? So you have to make sure that your aesthetic matches up to the clinic and specifically the surgeon that you're choosing. I think that's great advice from Mo.